So the way that I'm going to set up is you're going to have the client right here, and the top of their shoulder blades will be right off the edge of the table, and then you're basically going to have your hands cradled just like this. And this, say we're treating the left side, so the top hand is going to be our support hand. So what I like to do is I count some landmarks from where we go, and then down. So we go down here, and the first one you're going to find is at C7. So I want you to go 7, 6, 5, 4, and that's where you're going to hold and cradle, and it's going to go just like this. And then you're going to bring the other hand around just like that, and then everything is going to be nice and supported, and you're going to be able to fulcrum and open that up. Because what we're treating in here is these nerve roots, and the scalenes go over top. So this will really help you with the palpation. So we're going to create a fulcrum. You see how my hands are here, and what you're going to do is open it up just like that. You have a little bit of tension, and we're going to go in and feel on each one of these nerve roots, and we're going to find the area that's the least compressible, because that's where that scar tissue is. So what you're going to do is sink in and see what you feel. So first you'll have the C5, C6, then you'll have C6, C7, and then C7, C8. Those are the three that you're going to work in there. So when you find the one that compresses the least, that's where you're going to want to treat. When you find the one that compresses the least, that's where you're going to want to treat. So the way the treatment is going to work, you're going to be in just like this, and what you're going to do is start them in neutral, and say we're going to treat the C6, C7. So we're right here, my thumb is here, and we're going to use the pads of our thumb to open it up this way. That's going to allow us to get in there. We're going to be nice and relaxed, and then the first thing we're going to do is we're going to get some depth with a pec push into there, and then we're going to come out just a little bit. Normally we come out 10 to 20% when we're treating just scar tissue, but since this nerve is here and it's deep, we're only going to come out 5%. Now the next thing you're going to do is you're going to get your tension with a body lean like that. You're going to get right over top of that. And you want to pause just before that happens and hold that. And the way the motion is going to work is you're going to take this left foot, and this is going to be your push foot, and your right foot is going to pull. So what you'll feel is a slight push and a slight pull as I bring it through just like that. And we're not going very far as we go through because we're only treating that one level as we go in there. And only treating that one level as we go in there. So this is actually going to be what's called that internal slide. So when you set it up just like this, you're here, your depth comes with your pec push, your tension comes with your body, and you're gonna push with that left foot and pull with that right, and you're gonna force that to roll over your thumb, but you're not gonna move your thumb, and it's gonna come from there. So I'm gonna show what it looks like on an actual client. So once again, positioning, you're gonna have them come to the edge of the table, just like that, one more scoot back. So their shoulders are here and your head's gonna be cradled in here. First step you always wanna do is have them tuck their hands under their butt. It's gonna help everything relax. So say we're treating that left side like we said, this right hand is gonna be there. We're gonna go in and count. We're gonna have C7, C6, C5, C4. I'm gonna create that knife edge and just hold there and see how it's nice and supported there. From there, and now the next one we're gonna go in and we're gonna start to palpate those different regions. So we wanna use this thumb as a fulcrum to open it up as we're palpating. And we're gonna sink in first, and that's 5, 6. Just push with that pec and see, is that compressing or not? Then work our way down. That's 6, 7. And then we're gonna go 7, 8. In whichever area feels like it's not compressing enough, that's where that scar tissue is. So let's say this one's at C6, C7. I'm gonna start here nice and neutral. My arms are nice and relaxed on my side. And what I'm gonna do is take this right hand and push it into my left. That allows my thumb to sink in there nice and easy. Then what's gonna happen is I'm gonna get some depth by pushing with my pec, and my tension is going to be that body lean. And I'm gonna be nice and loaded, and as we said, I'm gonna push with this left leg and pull with the right, and we're gonna go nice and easy, and I'm gonna keep that pressure and that tension and let that slide over my finger. I'm not sliding my finger, I'm letting it come to me because that is internal slide, not external slide. So the key is palpate it under tension. Once it's there, you're gonna fulcrum that in, nice and relaxed, and you're gonna get that pec push for your depth and a body lead for the tension. And then you're gonna push with this left and pull with that right and have it go through just like that.